What is the direct anterior approach, DAA, for hip replacement? The direct anterior approach, DAA, for hip replacement involves accessing the hip joint from the front, avoiding significant muscle cuts. By minimizing muscle disruption, this method preserves muscle integrity, enhancing the recovery process and reducing postoperative pain. DAA allows for a potentially quicker recovery, enabling patients to resume daily activities more swiftly and with less discomfort. Utilizing precise instruments and advanced imaging, the approach helps ensure accurate placement of the hip implant, leading to better surgical outcomes. Patients undergoing DAA often report lower pain levels and faster return to normal functions post-surgery.